All right. Welcome again to everyone on the call. Thank you again for joining us for our Person and Family Engagement webinar. We are going to go ahead and get started. So this is the Compass PTN PFE kickoff event, and we are going to be focusing on person and family engagement throughout TCPI. So today's speakers are myself, Katie Reese. I am the program lead for statewide strategies with the Iowa Healthcare Collaborative, one of the lead organizations within the Compass Practice Transformation Network. And I'm also joined by Susan Brown, who works with Telligent and is also a component of our Compass PTN. So as we go through just a few brief housekeeping statements, all lines are currently muted. We want to make sure that we don't have to compete with any background noise with the number of folks that we have on the call, but our chat function is open. So please feel free to share and pose any questions or comments. We will try to moderate them as they come in, but we will be stopping at the end to allow for questions and answers, and we'll address the chat as they kind of come through. Our goal for today, again, with this kickoff event is really to have something that is more of a discussion related to person and family engagement. So today we'll discuss the role and value of person and family engagement in practice transformation. So what is PFE and what is CMS's commitment to PFE? We're going to highlight key opportunities to engage patients and families in our practices, so focusing on strategies and tools that we can implement and how would we measure our success. We'll also outline the structure and next steps to progress PFE within Compass PTN, so looking at the tools and resources that we're able to offer and looking at the practical support that's available to our clinicians. So starting off, what is person-family engagement? Within the CMS Partnership for Patients Initiative, CMS has said this about person and family engagement. Patients and their families are essential partners in the effort to improve the quality and safety of health care. Their participation as active members of their own health care team is an essential component of making care safer and reducing readmissions. As you look at that, there are a couple of phrases in there that I have bolded in there, and I've done that purposely. When we think about person and family engagement, the key area that we want to drive on is, again, it's not necessarily how we're talking to our patients or what we're doing to them, but really what we're doing in partnership with our patients. So partners and participation, active team, again, proactive interaction, not only on our part, but also with our patients and how they respond back to us. So it's really a reciprocal engagement. When we think about person and family engagement, here are some of those key phrases that come up. We talk about partnership, family, collaboration, respect, sharing, trust, informed, and I think one of the key areas that we talk about is change. So again, being open to changing how we do business and how we are actually engaging with our patients to make sure that we are acting in the best team possible with one another. And again, one of the key areas to hit on again is when we talk about person and family engagement. It's been kind of a buzzword for us as we kind of go through, and it's really been something when we talked about some issues with health literacy and teach-back and how we communicate with our patients. But I think it's really important for us to remember when we are talking about practice transformation, we're talking about this transition to value-based care, that it really comes down to what is the common denominator. So you'll see there on the slide, even within the hospital engagement network with the Partnership for Patients, you look at those health outcomes that we're all focused on, our PQRS measures, our practice assessments as we go through. The key factor for that is really the people, and that is the common denominator about what we are doing. So our work's about more than improving just numerators and denominators. For example, each one of the digits in our measures equals a person. So each A1C that's controlled means a patient that can walk their daughter down the aisle. Every hypertensive patient in control is a parent able to keep their CDL and their job and in turn be able to continue to support their family. Each child that receives appropriate care for their upper respiratory infection means that when they really need that antibiotic, it will work and they'll be able to recover and avoid more time spent away from school and activities. So again, all of the work that we're doing really comes into what we're doing for people when we're looking at person-centered care.
Hi, this is Susan, and I'm going to be covering CMS's commitment, strategy and foundational principles for person and family engagement in the next several slides. So in case you weren't aware, person and family engagement has become a very top priority topic at CMS. And in fact, just this past December of 2016, they released a formal strategic plan. It's 17 pages. You can find it by simply Googling CMS Person and Family Engagement Strategy. They also, put out a summary document. And these two publications lay the foundation for why this has become so important to CMS and really establishes their commitment and their strategic vision for person and family engagement. If you had the chance to attend the Quality Conference in December, it was very evident by the number of patient representatives and them sitting in the front and the number of times this was mentioned that this is definitely front and center on CMS's mind. So PFE really strengthens CMS's ability to achieve their national quality strategy, which is to improve health, improve the healthcare experience, and improve health outcomes. So the strategic plan gets into the values of PFE, which is person-centered care, health literacy, accountability, and respect, as well as the goals, partnering with communities, respecting values, preferences, and promoting self-management of disease, creating a culture of partnership and experience and best practices. So all of these things are part of this formal strategic plan that CMS has put forth. How does CMS define person and family engagement? They define it as patients and families are partners in defining, designing, participating in, and assessing the care, the practices and systems that serve them to assure they are respectful of and responsive to individual patient preferences, needs, and values. Again, Katie has highlighted these terms. This collaborative engagement allows patient values to guide all clinical decisions and drives genuine transformation, which is important. We're all part of a practice transformation network. So collaborative engagement drives genuine transformation in attitudes, behavior, and practice. So in reality, providers and healthcare organizations can only do so much to transform our healthcare system. You can only do so many redesign projects, so much workflow analysis, so much evidence-based medicine and decision support. But without the patients, families, and caregivers, you can never achieve the scale of transformation that we're looking for in our healthcare system and that we need in our healthcare system to really see exponential change and the improvement that we're all trying to see that can't be accomplished without the patients, families, and caregivers. Here are a few definitions taken from the strategy summary on the CMS site. So what are the terms frequently used in these person and family engagement discussions? So the first one is person. We've all heard patient engagement for years, and now all of a sudden we're seeing person everywhere. So why the change? Well, the term person really reflects the fact that we want to see people as more than just a patient, to recognize that there's so much outside the healthcare system that's relevant to someone's health and well-being. So we often talk about having a whole person orientation or mindset in this work, and thus the term person is used instead of patient. And then secondly, family. This is a broad term that's really defined by the person receiving the health care themselves. It could be a group of informal caregivers along with primary caregivers, but it's the people in that person's life that are considered necessary to support their care and help them make informed healthcare decisions. So person and family engagement. And then provider is a term that refers to both individuals and institutions or organizations that provide care and services. So what are the foundational principles in CMS's person and family engagement strategy? Well, there are 5 listed here. The first one is to promote shared decision-making. What is that? Shared decision-making is a collaborative process that allows patients and providers to make healthcare decisions together. So taking into account both the best clinical evidence as well as that person's values and preferences. So you can't have shared decision-making without understanding or asking what that person's preferences and values are. What are their goals for their healthcare? We often assume in healthcare, because of our training, that we are the experts. However, that person and that caregiver's goals may be very different, and so we need to be aware of preferences, values, and goals to actually accomplish shared decision-making. Co-creating goals is a great concept. Sitting down together and figuring out what is our end goal, what is our agenda for this visit, what is our vision for the lifestyle of this person. The next one is to promote person and family engagement best practices. So CMS is looking for ways to actually incorporate best practices for PFE into the work that we all do. And they've identified 6 metrics that we're going to start incorporating into not just the PTN program, but hopefully as time goes on more broadly into some of the other CMS initiatives. And then lastly, the last principle is to encourage engagement and self-management. And this is really key. I don't want to gloss over the self-management part. Most people spend such a small percentage of their lives actually in an office, in a healthcare office, in the healthcare system, that if we can get people to self-manage their condition or self-manage their own personal wellness, it will reap huge rewards in terms of lower costs, better outcomes, and reduced utilization of the healthcare system. So these are all foundational principles of person and family engagement that CMS is promoting, and I'm going to turn it back over to Katie.
Thanks, Susan. So as we went through, we talked about what is PFE and what is the commitment to PFE. The one thing that we want to continue to do is to really hit on what PFE really means. On this slide, you're going to see a picture of one of our own patient advocates that's worked with our hospital and some of our outpatient settings here in Iowa. Her name is Allie Wolfkohl, and that is her husband and their 4 children. And she has been really engaged in the process of, again, for us to even, when we talk about person and family engagement, to get down to the heart of it. So when we get back to it, when we make it personal, remember that when we talk about person and family engagement, we're talking about speaking with Allie, asking her what the goals are for her children when we're talking about their care, and really hitting back on that. So again, we want to make sure that not only when we talk about person and family engagement are we talking about what we can do in our practices, but also what we can do as a PTN, again, to continue to walk our talk and really engage PFE as a part of our structure as well. So PFE and the Compass PTN. So as we know, PFE is a primary driver in the change package. So that first goal that's in there is about going to person-centered care, and that focus on transformation towards value as a person-centered system. Again, we're all talking about transformation and value-based care, but I think when we get down into that, what does that value come as? Who's the one to determine that? And really it comes down to a person-centered system. We have an opportunity for those of us that are in Compass PTN and for our outpatient settings, primary care. PFE might be something that's a little bit new, but we have an opportunity to build off the experiences and the successes from the Partnership for Patients. This is work that's been engaged since 2013 with our hospital communities, really looking at how can we better engage the patient, invite them to be part of their care team, empower them to be proactively engaged, and then look at their activation again when they go beyond their current setting, when they get back into their home, as Susan mentioned. You know, as much as we want to do the best clinical care, we have to recognize that we have a limited impact for that. Our best care only impacts about 30% of a person's overall health. The rest of that comes into when they're back in their community, back in their homes, and they're managing their care themselves. The one thing that we can go through before we talked about what is that common denominator, we talked about that transformation. We've seen the impact of person and family engagement. When we are actively partnering with them, we see significantly correlated improvement in a variety of different health outcomes. So in the Partnership for Patients, we saw higher PFE performance significantly correlated to higher performance against adverse events in at least 7 different areas. So those top performers that significantly had their 5 PFE metrics that were implementing best strategies, they were really able to make impact. And remember that our hospitals can serve as mentors. They can share lessons learned and collaborate for advancing effort. This isn't something that we have to do in a vacuum that we're doing alone. It's really a relay. It's a continuation of the work, looking to expand our efforts out to where our patients spend most of their time in our system, and it's our greatest opportunity. You know, our lessons learned from the HINS, as we look forward to this again, and we try to apply this to the PTN, is what sometimes seems easy is not. We want to do it, and we're not always sure how. So how can we collaborate and share what experiences together to know how we can engage best? Need for stepped and gradual approaches. We'll kind of go in through that process a little bit more and say, how can we actually make this meaningful and impactful? And when we talk about person and family engagement, it's such a broad concept and it encompasses so much. Sometimes it seems a little bit difficult to know where to begin, so we're going to go into those bits. And then we're also going to talk about sustainability. So again, how do we make this the standard of care versus, again, we don't want anything short-term. We don't want it to be just an initiative that we hit on, but how do we really make this how we do business? And again, recognizing that patients and families need help getting there. So as much as we can equip ourselves and educate ourselves, we also need to be prepared to help support our patients to be able to accept the invitation to be part of their care team and to know how they are to engage, what are their roles and responsibilities. And when we get down into it, it's really about the culture. Again, we talk about a culture of safety and a culture of patient-centered wellness. So when we talk about PFE and the Compass PTN, there's really a comprehensive strategy. There are 3 pillars to PFE implementation. So we want to involve patients and families at the point of care. This is really the opportunity when we have our direct engagement, our front-level staff that are engaging with them. That could be our nurse assistants that are working with them. That could be our physicians when we're having our consults. It can also be when they're going through and they're checking in at that front desk. Again, all of these different levels and opportunities to engage with patients and involve them. There's also partnering with patients and families as advisors. There's great value in, after the point of care, listening to the patient stories, their experiences, and inviting them, again, to not only share those stories, but to be part of the solutions. As we go through and we look at designing a person-centered care system, if we don't invite those advisors in there and hear their voices, we're really just going off of a whim. How do we make sure that it's really designed with them in mind if we're not asking them to be part of that team? And then working with patients and families to build a healthier community. Again, recognizing that when we talk about person-centered health, we talk about value-based healthcare. We're really expanding beyond the walls of our clinics, beyond the walls of our systems, and really looking at our communities and patient experiences over the continuum of their lifespan and throughout their experience in the healthcare system. So a defining commitment. So again, not only has CMS made a large commitment to PFE, but the Compass PTN as well. As we went through and we talked about our goals together for the next 120 days, we recognize again that not only is PFE defined as part of the change package, but as Susan mentioned, it is a key component to whether or not we are going to be able to achieve the scale of transformation that is truly needed in order to move towards value-based care. So as we look through PFE implementation over the next 120 days, you'll see that for our Compass PTN, which is over 8,600 clinicians, that 41% of our practices indicated that we're going to implement at least 2 PFE metrics. So as we go through those metrics, again, are just going to be strategies that we look at how can we better engage patients and families when we go through our care practices. So again, this is our defining and heavy commitment as we go forward. And again, it's a challenge for us, but I think it's one of those things that we can really hit on. I know person and family engagement, we talk to our clinicians, it's one of those key areas where there are a lot of champions on the ground and looking to really see how they can make those impact. So a gauge for current practice. One thing that we want to hit on is that we kind of went through, and because of the Compass PTN, many of our clinics actually participated in a pilot survey to kind of gauge and see what current practices do we have in place already within our Compass PTN. So we go through and we looked at patient and family and voices. How are we engaging folks in through that? Do we have some clinics that maybe have advisory councils or have patient representatives that participate on quality committees? We talked about medication management, asking if they had things that were in place to really support patients and families as they're going through to reconcile those medications, to handle new medications, and to make sure they're being taken appropriately. Health literacy was a component that we talked about. Again, what practices and surveys maybe are being put into place to assess. Patient activation. We talked about shared decision-making. What practices do we have in place? Are we focusing on shared decision-making? And active e-tools. So you'll see when we break this down, we had quite a few folks that actually went through and said, yes, we have those in place in some capacity. And then we had quite a few that actually said, we're planning for it. So we may not have it now, but within the next 6 months, we're really trying to focus on that and looking at opportunities that we have through that. So if you look at this gauge for current practice, we really have a really nice foundation for us to build upon, and we are really excited. Again, you look at that active e-tool and you see all those yeses. I know Susan and I are really excited to move more of those yeses and all of those other metrics as well. So establishing PFE as a standard, that has been something that you've heard me say multiple times throughout this kickoff event. And I think that's really where it comes down to, again, we talk about that culture. We don't want person and family engagement to be that next buzzword, and we don't want it to be the exception. But we want to integrate PFE throughout all of our efforts. So again, when we talk about person and family engagement, where are those areas at multiple levels throughout the settings? So when we talk about our clinical interventions, when you look at your work plans for our clinicians, when we break it down, it talks about patient self-management plans. Are we using TeachBack? What about those direct engagement points, again, at that point of care that we can incorporate and invite our patients and families to be part of that team? Operational practices, again, we talk about sustainability and looking at the infrastructure. So our patient-centered medical home principles. Do we have person and family advisory councils? What about those e-tools? So again, those patient portals or those opportunities beyond that clinical, that one episode and that appointment for the patient and their family to be able to communicate with their practitioners. Looking at measurement, again, PFE metrics and aligned quality measures. So not only are we talking about some of the quality measures that are coming down as far as through the PFE that are being self-defined, but also looking at our core quality measures, such as closure of the referral loop, documentation of medications, some of those different areas that really engage the person and family again and hit on that person-centered value-based care. And then leadership commitment. So mission and vision, looking at consistent and persistent language and communication, again, from the top down, really looking at, again, who's going to be the champion and establishing this as a commitment to a culture change.
Okay, so we all know that resources are very limited at our organization. So how do we actually build a community of practice around PFE? And it starts with establishing the business case. We all know that our leadership wants us to make the business case for these types of activities. So to the extent that we can connect PFE efforts and tie those to the success of an ACO, for example, or of our patient-centered medical home initiatives, or even our success in the quality payment program, that helps establish the case for implementing more PFE activities locally. So for out on the web.
Are you able to hear us now?
We can hear again. Okay, our apologies. I'm not sure what happened there, but thank you to those of you who wrote in because we were not aware that you couldn't hear us. So, okay, so we will pick up with establishing the business case locally for your PFE efforts. And I'm not exactly sure where I cut off, but I was making the point that to the extent you can tie your PFE efforts to helping your organization succeed in programs like an ACO or the Quality Payment Program, that will really help you establish with your leadership the case for PFE efforts. And taking the Quality Payment Program as another example, so if you look at the components of the QPP, there are many of the clinical practice improvement activities that involve PFE, and we've actually done a crosswalk of those CPIA activities to the Quality Payment Program. Of course, the meaningful use or the ACI component involves person and family engagement through the electronic tools. To improve quality, you must have extensive patient and caregiver engagement. And then cost, while not a component this year, going forward, we just will not be able to reduce healthcare costs without significant involvement from patient and families. So the point is, make your business case locally, tie it to the goals of these other initiatives, and that will help you articulate and emphasize investment in these types of activities. Always come back to how the initiatives will impact patient safety and health outcomes. These two topics always resonate with providers and administrators. If you can link your efforts to improving patient safety and improving health outcomes, that's always a good thing to come back to. So that's establishing the case, and then build the vision. So take a look at your organizational mission and vision statements. If they include person-centered care, then great. Keep emphasizing that. If they don't, you may want to revisit the verbiage and consider adding person-centered care to your mission and vision. And then we've already talked about PCMH and ACO structures and how those in and of themselves can help build the vision for PFE. And then having activated patients advances all of these concepts. That advances your corporate mission and vision and your involvement in other significant transformational efforts. Okay, and continuing on with your local efforts of building a community of practice, we need to provide meaningful and achievable approaches. We can do this in bite-sized chunks. This does not have to be a big bang rollout of a huge PFE initiative. Small efforts can be meaningful and achievable and help get you on your way. We wanted to make the point that PFE happens at multiple levels. So there are many times and ways to engage persons and families. You can think about approaches before they even come to your organization, so pre-visit. What can happen in the waiting room to engage? What's the front desk process look like? Have you walked through it yourself? What about during the rooming of a patient or during the visit or at the close of a visit or after the visit outside the office? So PFE can happen at multiple levels. There are many opportunities, and if you start to break down a patient's journey from pre-visit to post-visit, you can find many things to take a look at. Remember to meet your practice and your clinicians where they are and build from there. You want to start with a culture or a mindset that we are all on the same team with our patients and caregivers. And patients want efficiencies, they want improved outcomes, they want lower costs just as much as the healthcare organizations do. We are all on the same team. And without that culture or mindset, PFE will become nothing more than a checkbox. So meet clinicians where they are. If there's no culture of PFE, start with that. Start with creating that mindset and culture. If you're fortunate enough to have a culture of PFE, then start looking at, for example, the 6 metrics that Katie's going to go through. And I guarantee this will generate ideas of things that you can work on. We always say to remember to celebrate successes. This is important in any improvement initiative. And be flexible and innovative. One thing that excites me about the new payment models is that when we're all finally paid for outcomes, it takes the focus off of the volume, it takes the focus off of the fee for services, and it allows us to really focus on person-centered care. There will be more flexibility to be innovative under these new payment models. We really need to get away from this notion of just face-to-face traditional healthcare visits, that everything has to happen under that paradigm. If you have an idea or a patient or caregiver has an idea, don't immediately dismiss it. Think about it. It might not be possible now, but at least think about it and incorporate new ideas and be flexible and innovative going forward. Okay, so what is the call to action? In the PTN program, we are soon going to begin measuring your patient and family engagement activities. And Katie's going to go over the 6 metrics in more detail, but these will become part of the practice assessments that are integral to the PTN program. So we are going to begin metric implementation and reporting yet this spring. And so how can Compass support you in this effort? We have set up a website with on-demand PFE resources. So we have the Compass website already. We've added another page with PFE-specific resources. This resource page will provide focused overviews of each metric along with recorded guidance snippets, so about 5-minute explanations of each metric. And we're also integrating PFE into our technical assistance through our quality improvement advisors. Look to them for recommendations, and they will be talking to you about your PFE efforts in the upcoming months. We want to move beyond just the metrics, however, and we want to give you the skill sets to actually make this real. So we will be providing ongoing education and skill building to help you succeed on topics like health literacy, teach back, and motivational interviewing. Compass will be hosting some of these trainings. We're also working in conjunction with a group called MedStar, and we will also be sure that you are linked to any PFE SAN events that are offered through the TCPI program. We consider this much more than a short-term blast on PFE. This is an ongoing commitment from Compass to support you in achieving true person and family engagement and changing how we deliver care in partnership with our patients and caregivers. Okay, so now we're going to move into the metrics discussion and what do we do in healthcare or other industries to know if we're improving? We all know that we measure it. And so we've established a goal within the TCPI program that we would have some clear measures to track PFE progress. Otherwise, it's just sort of this fluffy notion, this fluffy concept. So how could we make this more concrete? So there is a subgroup, a work group within TCPI that has come up with a diverse set of measures that are clinically relevant and important to both patients and providers. Our hope is that these metrics create wide buy-in from the PTN participants and wide adoption and implementation of the metrics. We want to assist in the development and dissemination of supporting resources for these metrics. So as you look for ways to meet the metrics that CMS is going to put out, we want to provide supporting resources for those. And the metrics actually came from this work group that I mentioned, which we call the PFE Affinity Group. And then there are other subgroups working on various aspects of person and family engagement. The specific group that developed these metrics within the affinity group is called the Performance Metric Flash Group. And this consisted of over 25 representatives from across the TCPI community. So multidiscipline, clinicians, non-clinicians, multi-stakeholder participants. And they reviewed current PFE practices and performance measures and identified 3 foundational domains that are considered PFE best practices, and chose 6 measures within those domains to be tracked and evaluated over time. These metrics were pilot tested among 2 volunteer PTNs, Compass, which is our PTN, and Great Plains. So thankful for those pilot testers who helped to verify the appropriateness, clarity, and applicability of these metrics. So I'm going to provide an overview of the metrics, and then Katie's going to go into each one individually. So the 3 domains that I mentioned are, how are you engaging patients at the point of care? So that's one domain. Do your policies and procedures support active person and family engagement? And does your governance structure support person and family engagement? Does it incorporate the patient voice? The metrics are listed within each of the domains. So for example, at the point of care, do you use an e-tool that's accessible to patients, caregivers, and clinicians to share information? At the point of care, do you support shared decision-making, that collaborative discussion and goal setting and preferences and values sharing? Under policies, do you use a formal tool that assesses and measures your patient activation? Do you use a survey for health literacy? Do you promote medication management practices that are person-centered? And then in terms of governance, do you have policies, procedures, and actions that actually support your PFE efforts in governance and operational decision-making? Do these governance policies incorporate the voice of the patient? So that's an overview of the 3 domains and the 6 metrics, and Katie's going to quickly go through each one to give you more ideas on how these could potentially be met at your organization.
Thanks, Susan. So again, as we talk about these metrics, the one thing we want to hit on again is not just are they measures, but they also outline opportunities for us. So again, if we're looking at those first steps that we might be able to take in order to start implementing PFE, what are some opportunities? So PFE metric 1, an active e-tool. So the measure reads, does the practice use an e-tool, a patient portal, or other e-connectivity technology that is accessible to both patients and clinicians, and that shares information such as test results, medication lists, vitals, and other information and patient record data? This is really important we talk about that is accessible to both patients and clinicians. The reason why it focuses on active e-tools versus, making sure that we're giving information to patients, such as when you leave your appointment and you get a summary of your statement, or a summary of your visit that's there, what they want it to be is reciprocal. So again, not only do they have convenient, on-demand access to their information, so that way they can review it at their time, their leisure, and at their pace, but also the opportunity, again, to communicate back and forth with their provider. So it's not just a one-way stream of information. One of the ways that you'll meet this metric is if your practice uses and makes available to all your patients an e-tool that allows patients to access their medical record and have an easy, direct way to communicate with providers. So as we went through our gauging survey, you'll see that is the one that typically most of our practices that took the survey said, yes, we have an active e-tool. For some folks, that's an easy thing. When they did your EHR upgrade, that patient portal was something that was included there. Maybe your system uses an app that's on there, so varying degrees across that board would meet that metric. But for those of our patients or practices that maybe their EHR doesn't fully support that yet, here's an opportunity again to look at what opportunities do you have for eTools to enhance that communication and that opportunity to share information. PFE metric 2, shared decision making. So does the practice support shared decision making by training and ensuring that clinical teams integrate patient-identified goals, preferences, and concerns into the treatment plan, such as those based on the individual's culture, language, spiritual, social determinants, etc.? Again, this really comes into the process with shared decision making, as Susan mentioned. A lot of times in our professions, with our experience and our education, we look at ourselves as the experts and say, for example, our patient with diabetes, our goal is again to have their A1C at 7. When we sit down with them, we talk about those shared goals. Part of it is also looking at the language that's important to them. So it may be, well, my goal is that I'm going to be able to walk my daughter down the aisle, that I'm going to be healthy enough to be able to do that. So really coming together to have that shared vision, understanding where the patient's coming from, being able to frame the treatment plan and the next steps in a way that is impactful and meaningful to their life, that goes beyond just that episode of care. So again, the practice will meet this metric if we're using a tool to promote and teach shared decision-making in order that patients and their families, according to patient preference, are authentically part of the care team. So again, one of these opportunities could be if you are doing shared decision-making education, but perhaps when you talk about a patient plan of care that gets handed to them afterwards for their self-management, how are those goals self-identified? Do you sit down together and share that information out when you talk about that treatment plan? That's one of those opportunities, again, we look at shared decision-making, taking it beyond something we know we should be able to do and actually making it impactful and meaningful. PFE metric 3, so patient activation. So person and family engagement goes beyond, again, just inviting the patient and their family or caregiver to be part of the team, but really how do we make sure that they feel equipped and empowered to be a proactive member of that team? So does the practice utilize a tool to assess and measure patient activation? This is one of those metrics for folks that may have heard of it that gets a little confusing because we have some tools, so the PAM tool, that's out there that, you know, if you have the resources, you're able to purchase and be able to implement that, but there are multiple opportunities. Again, this is where we come in and say that there are stepped and gradual approaches, and to be innovative, it doesn't have to be this one box fits all. So you'll meet this metric if your practice is using a standard PAM tool to assess and measure patient activation, or if your practice has developed their own tool. And we welcome people to share the tool in the comment box and looking at how you assess and measure patient activation. So again, are you innovative? Do you have something that is happening for yourself? And does your practice use any of the following other tools listed below to assess and measure patient activation? So again, there are a variety of different tools as we go through, especially if you go onto our website, that we've listed out the opportunities and some other tools that are there. So there's a variety of different things that are there. AHRQ is coming out with more patient activation tools that will be readily accessible, and that was kind of the intention for that bullet there. It was supposed to be released in January of this year, but it has not yet, so we will keep everybody up to date on that. And as we kind of go through, I've got a couple of chats that I just noticed that came up in relation to PFE metric 1. So PFE metric 1, again, if we just pop back real quick, for active eTools, would this be measured by the number of patients utilizing our eTool? How are each of these PFE metrics measured to quantify the outcome? So when you look at these metrics as we go through versus our typical numerator-denominator measurement, these are more of kind of a yes, no, and we're planning to implement. So if you actively have the tool, then you would meet the metric. It does not at this time ask you to break down the current access volume that your patients are using. So again, this is kind of a stepped out approach. Again, as we continue through the PTN over the next couple of years, that may very well change, but really these are kind of those initial measures looking at, do we even have the resources and equipment in place to support that? So, and again, the PFE metrics we kind of go through to quantify the outcome as we go through any of these, including as we lead up to 3 again, is going to be such as was in that gauging survey. So yes or no, do you have these items in place? And this was kind of the process was taken off of the Partnership for Patients and our experiences with the hospitals, and then being able to go through and actually implement yes or no, but also being able to identify that yes, you're looking to actively implement. And this is another opportunity that when we look at the measurement for it, it goes beyond just a check mark, but there's lots of value in the qualitative information that we get as far as we maybe don't have it in place yet, but we're looking at it, we're in the current process for review. So again, when we look at the measurement for it, there's lots of value there, but let's not get held up in do we check that box and at what level for that. So really this is the initial component looking to say, do we have the foundation there to support real person and family engagement? So moving ahead with our metrics. So PFE metric 4 is health literacy. So again, health literacy for a lot of us, if you're familiar with it, it goes beyond, general capacities for literacy and whether or not we have materials at certain reading levels, but it really breaks into the patient's ability to comprehend their health information, their ability to access that health information, and to use that health information to make informed healthcare decisions. So one of the ways that we can really look at making sure that we are reaching out and being meaningful to our patients is knowing how they need to receive information at what level that is at. So do we use a health literacy patient survey in order to capture health literacy and to assess that? So again, that could be our CAP survey. And that's something that some of our systems are already using, but there's also opportunity beyond that. So you'll meet this metric if the practice is using a health literacy patient survey to systematically identify and address health literacy issues. So again, when we talk about those additional resources and being innovative and thinking outside of that box, there are additional opportunities beyond the CAP health literacy item set in order to assess patient health literacy. There are tools that are available through AHRQ that measure health literacy. So they have one that's called the Short Assessment of Health Literacy that's available in English and Spanish. And it's kind of a flip card that goes through and provides a variety of different health terms and asks the patients if that's a health term or if it's not. And you go through and you can score that. And it gives you an idea where someone's health literacy level fits. And that way when you are designing their treatment and their interaction, you can really figure out at what level and how intensive that interaction needs to be. So again, recognizing that they're going to need more than a handout. They're going to need additional support and assistance when they go through their medications to truly understand them. Health literacy includes that numeracy, so it really bridges in when we talk about PFE metric 4. Each one of these metrics and each one of these strategies really building upon one another and really looking at a comprehensive PFE strategy. So again, we talked about health literacy. How does that bridge in again? So medication management is another one of our metrics. Does the clinical team work with the patient and family to support their patient and caregiver management of medications? So it's defined that you'll meet this metric if your practice has a systematic standard method in place to evaluate and support patients and their caregivers and medication self-management. So this could be something, does your practice have a policy or a protocol that when a patient is discharged and they have their post-discharge appointment, that medication reconciliation, that is part of their appointment that's there, that they actually sit down and go through that process? Is there a policy in place to where you have engagement with the pharmacy as well, and you have some sort of process in place to where you know that that patient is going through and getting the medication review rather than just handing them a script or saying that we're going to prescribe this and pick this up at your local pharmacy? What does that process look like? There are lots of opportunities, and again, there's a lot of gray in this area. There's some black and white where, yep, this meets. Then again, there's that innovation. How do we actually put this into practice? What does that system look like? So again, as we continue on, we'll also talk about ongoing resources as we go through. And as Susan mentioned, we're in this together, so this is something, again, that we're learning all together as a group. So as you guys have best practices or things that you've been doing, we want to hear from our clinics because we can share that across the board. And then PFE metric 6, our final one. So support of patient and family voices. This again is in that domain for governance. So are there policies, procedures, and actions taken to support patient and family participation in governance or operational decision-making of the practice? So patient and family advisory councils, or PFACs, which are some of those things that we've heard. If you've been on a couple of the support and alignment networks on their recent webinars, they've been talking a lot about some of the PFACs that clinics have started to establish. But it goes beyond that. So practice improvement teams. So even if you have a smaller group, is there a patient representative on there? Board representatives. So again, we know sometimes there's some difficulty with appointing board members and some of those regulations that go with that. But do you have patient representation on there? If you have a PFAC, does that PFAC have an opportunity to report out to your board? So again, multiple ways that you can meet this metric. Really focus on whether or not your practice has a process in place for including the perspective and voice of the patient and family in all aspects of governance of the practice. Again, really wanting to get at the heart of this when we were looking at designing and implementing changes to our design system. Really focus on, did we hear from the actual patients? Do we hear from our customers, the consumers of our healthcare system, to know if it's really being designed with them in mind? Again, we can have the best of intentions, but if we want to be really impactful, it's best to hear from them and hear from their true experiences. So again, we had some questions about this again. How do you report? So initially, when we talked about we will actually start looking at our metric implementation reporting this spring, it will be through a survey. So we did a pilot survey monkey that was already conducted, and they're looking at ongoing survey opportunities to establish a TCPI-wide baseline. But as we go forward, the commitment to PFE is strong to where it's going to be included in our practice assessment tool. So there will be a separate spreadsheet within the Excel document that will lay out the 6 PFE metrics and give an opportunity for folks, again, to implement, to indicate, yes, we have this in place already, no, we do not, or the opportunity to say that we plan to do so within 6 months. So again, as we continue with our 120-day plan, we have the opportunity to continue to push that forward. Just a quick note that the PFE metrics will not factor into the PAT scores. It's going to be something that's really used to actually look at the evaluation of PFE versus impacting those PAT scores. So, and we anticipate that they will be included in the PAT coming in summer of 2017. So I'm going to turn it back over to Susan, and she's going to talk about some of those support and resources.
Okay, we're getting close to closing out here, but we wanted to make sure you were aware of resources that are available to you. So I mentioned earlier on the Compass PTN website, we've added a PFE resources page, and the link is listed here. And this provides an overview of person and family engagement in TCPI and Compass PTN, individual metric outlines, so the 6 metrics that Katie just went through with some associated resources. And we will be continuously updating this over time. Another great resource is the healthcarecommunities.org. And if you're familiar with the interactive change package, domain 1 of the TCPI program is person and family engagement. And within each domain, there are many subcategories. And if you keep drilling down in that change package, you can find all kinds of really valuable resources that have been submitted by the PTNs and SANs related to numerous PFE topics. So I encourage you to just go in there and play around with it, see what's out there. There are some great resources posted. As I mentioned earlier as well, we will have ongoing PTN education events, educational series focusing on metric strategy implementation and skill building, and going beyond the metrics to actually making this come alive at your organization. We will be including PFE in all of our learning events, especially our in-person learning communities that we hold annually in each of the Compass PTN states. So just a reminder as we close out that person-centered care doesn't start and stop at the door of your organization. We need to be considering the whole person and their lives outside of the office setting. PFE is much more than just meeting a metric or checking off a box. And it's not just about reimbursement or payment models. We want to remember the triple aim, the CMS quality strategy of improving patient care, improving their experience in the healthcare system, and improving outcomes and quality of life. Isn't that something that we all want for ourselves and our families? So we are in this together. Patients and caregivers are partners. They're valuable partners that cannot be overlooked, and this can be done. We just need to get more intentional about it. And that closes out our webinar content. Let's see if we have any questions that came through in the chat.
We have a couple questions that came through regarding the practice or the patient activation measurement tool, so the PAM. As you go through and check out our website, there are some opportunities through some of the QIO, QINs for the access to the PAM tool at limited cost or no cost. So we will be confirming with those QIO, QINs to verify which ones of those have that opportunity. But again, that's one of those areas that we really want to focus on. Again, if you have access to the PAM, that's an excellent tool, but there are plenty of other opportunities to continue to look at patient activation and how to assess that within our patient population.
And feel free to contact Katie or I if you'd like to discuss that further.
So, yeah, we're not seeing any more questions come through, so we will be cognizant of your guys' time and give you guys an opportunity to get back into your day. But as Susan mentioned, as we move forward, again, this is an ongoing commitment for us, so you will continue to hear information, continue to hear the call to action for PFE. So check out the website to see the resources that are there. Again, Healthcare Communities is really great as well. But don't be afraid to reach out to any of us as we move forward. We are happy to be here.
Thank you. Have a good afternoon.